Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We have David in here with us bright and early this morning, and David is a Navy veteran coming here from San Diego, California. David served in the Navy for several years during the Gulf War, right?
Yes, sir.
And he's been having low back pain and bilateral radiculopathy, but worse on that left leg all the way down into his foot. He's getting radicular pain also down into the right leg and foot. He's had weakness in both legs and actually has had your legs give out on you a couple times, you told me.
Yes, sir.
We did a heel toe walk on him to evaluate his foot drop thing, and show him your heel toe walk. I got you. Well, there really is none. You got a little bit there, but not much. Yep, okay, that's good enough. So that's a positive toe walk. He can't stand on his left toe for any length of time. Try your heel now. Heels only. And he can't do that either. He loses his balance.
Yes. Wow.
Easy. So that's considered a positive heel and toe walk, which leads to what's called foot drop. And foot drop is a very serious neurological sequela from the lumbosacral spine that goes down into the sciatic nerve and creates radiculopathy issues. He's also had paresthesia, which is numbness and tingling and cramping in his calves. He has a lot of neck pain and stiffness that's radiating all the way down to his left shoulder, arm, and hand. Goes down into the C6 dermatome, which is the thumb and finger and half of this finger, which is C6. He also has knee pain bilaterally. He's had, like you told me, 30 steroid injections.
Yes, sir.
In your career so far as a veteran.
Yes, sir.
He's fractured his left femur head back in 2014, had right medial meniscus surgery and several scopes, you told me, on both knees to get the cartilage out of there. He's got bone on bone in both knees. So this is David's first of 6 visits here at Advanced Chiropractic Relief this week. We did a very thorough history and examination on him, plus I reviewed his 30 pages of medical records that he brought here from the VA today. So David, you've been to other chiropractors and medical doctors for these issues already, haven't you?
Yes, sir.
Would you mind sharing with our crack addicts worldwide about your first experience here of me doing your history and examination compared to what you've had in the past?
We surpassed everything that the other doctors have asked me in the first 15 minutes that I sat here. This is the most thorough examination I've ever had, and I can't say enough good things. I'm actually.
And we're just getting started.
Yeah, I'm at a loss for words to say how great how confident I feel in your confidence.
Okay, good. And David's been watching our videos for some time now, and he's been educated. He told me he does lay on the floor and put his legs up on the couch or ottoman there to relieve that pressure off your low back, which you said does help you to do that.
Yes, sir.
And so he's been listening to our videos from an educational viewpoint, which is why we're doing these in the first place, is to educate the masses on the benefits of chiropractic care. We do things that are always in the best interest of our patients that come here. Whether you're a veteran or you're a football player or you're a housewife, we're going to evaluate you exactly the same way every single time, and you will receive the same Johnson technique adjustments on every visit as well, which he's getting ready to get his first one right now. So
my last primary care told me that they don't believe in chiropractic.
well,
So
that's their problem.
It absolutely is.
And it becomes the veterans' problems too, because if they don't work hand in hand with you guys,
Correct.
seeing chiropractors, then they're really limiting your treatment options.
Here, take this.
They'd rather stick you and take this pill and that pill and this injection and that injection. If that don't work, you can always have surgery, you know.
Right.
And you did have ablation, you told me,
Yes, sir.
3 or 4 times on your nerves out of your L4 and L5 and
Yep.
L2, L3 even. So he's got an extensive history, as you can see here. My chart's full. Okay, so let's do them the first time now. I'm going to do your posture again, David. So let's have you flex your hip forward and backwards for me so we can show our crack addicts. Yeah, see, he kinks up going backwards and it pulls going forward. His head is forward and translated to the right on the x-axis, positive Z translation on his cervical spine. I can tell he's a side sleeper most of the time, sleeping like this. Pelvis has shifted. Renee, move just a minute. to the right of center. He has less room here than he does over here, so his pelvis is translated as well. You got a little curve going on in here as a result of your head being forward and to the right. All right, so this is his first adjustment. I've already done his orthopedic neurological exam here, so let's have you on your... By the way, he has a diminished patellar and Achilles reflex bilaterally plus 0.5 compared to plus 2 at equal and active normal. His left leg is short by a half an inch down here. When I bring his legs up, however, they get even. That tightens up already in your low back and your SI joint on the left side, doesn't it, David?
Yes, sir.
So I came up here and palpated his left SI joint's tender, his right SI joint's tender, but mostly right here at L5. But that goes all the way up into the lower thoracic spine bilaterally with paraspinal muscle hypertonicity. He's got multiple thoracic spine subluxations and costovertebral subluxations. Traps are tight on both sides, but the left one's getting radicular pain. He's got severe misalignment C5, C6 here on the right, and also C3 on the left and C1 on the right as well, where he's getting headaches, occipital are moving up into his skull as well. So I'm going to show you his sacrodeviation test. Lift this right leg up for me, David. Okay, now the left one. As you can see, he has a significant left sacral deviation test, which shows that his sacrum has posteriorly rotated on this left side. So I'm going to be addressing that very first thing when I adjust him today. Okay, David, some of these might be a little sore at first, but they'll feel better once it gets back in place. Left SI there, right SI. Drive that sacrum straight superior to inferior. And then this is probably going to be the most sore, David. Exhale. There you go. It's a straight PDA on the lumbar spine. Yep. Okay. You'll make me work for him today, aren't you? Okay, still got a little left leg shortness there, so I'll adjust your left SI a little bit differently. There. That's better. Does this feel any easier at all yet?
Oh my God, yeah.
Imagine that. Pretty cool, huh?
Uh-huh.
You're gonna feel your head popping up on this next one, David. Now he's got a reverse cervical curve as well with major degenerative disc disease down at C5, C6, C6, C7. Let's turn you on your back now, please, sir. You okay?
Yeah.
Pretty deep in person, huh? A little deeper than what it looks like on YouTube, huh?
Absolutely.
Okay. I'm going to bring his whole head up and over his spine where we can try to help that curve out in his cervical spine. Now your ear's over your shoulder, which is where it's supposed to be. Put both arms out like this for me now, David. I know there are some of you out there watching this that are still questioning why I do such an extensive history and examination if I'm just going to adjust everybody the same. There we go. Should have felt that from your knee all the way up to your low back. Did you?
Yes.
Okay, keep breathing. There we go. Super. Okay. Let's sit you up here and face that away. And the adjustments look the same on all the different body parts that I'm adjusting, but I'm using different angles, different thrusts, different speeds, but the same. I'm gonna get that one again. Keep that head, there you go. It's gonna be difficult for you to keep your posture upright, but I want you to practice that.
Yeah.
Okay, let me have this. There you go. And these adjustments on the XYZ axes work. So yes, I'm going to continue adjusting the same way that I've been doing over the past 40 years because it works. All right, David, now over to your dream.
You have no idea how many people are waiting to see me on that. You should show this to your VA doctors when you get back out there. And you'll feel your legs raising up with the table now.
Okay, this is parallel for you right here, David. Does that feel pretty relaxed in your spine right now?
Absolutely.
Now with no pillow here, you've got a little bit of a lordosis going on in your cervical spine, which you don't get if you got a pillow
Right.
under there. Reverses that. I'm gonna pin your pelvis in on both sides with these big old pins here, David. There we go. Got you in there good and tight. You're not gonna get away now. Okay, want to keep your teeth together on this one, David. Don't bite your tongue. Breathe through your nose. With your right ear. There it is.
Oh,
Yes, sir.
my God.
Now, deep breaths. In through your nose, out through your mouth. Curl the nose toes up now. And looky there. He didn't have any reflex at all over on that table when I did his neuro exam. He's got a little bit more reflex here, but a little bit more jump there, which he had nothing on before. Did you feel the difference?
Uh-huh.
Okay, let me have your head here. Nope, I got you. Tilt right. Or left, I mean. There it is. Tilt right. That's it. And you've got some spurs developing down in that cervical spine that's trying to lock up your spine.
It worked.
We're still getting
I
it to
think you
move
just
though.
unlocked.
He did. Let me help you up. There we go. We're gonna stand here in front of the mirror again. All right. So the first thing I want to do, take a look in the mirror already.
Wow.
See the difference
I do,
already?
Yeah.
I'm gonna bounce these muscle spindles with this instrument. This will help relax your paraspinal muscles, David. There'll be some sore spots still at this point. Okay, here's your homework right here. Shoulders up and back, hold those there, flare these guys like this. We're gonna bring that head straight back, translate left, then look backwards. You're gonna feel a little tap on your atlas here. And there, now relax. Now go forward and backwards again. Wow. Should have felt a lot smoother, by the way.
Absolutely, yeah.
Take a look in the mirror now.
Wow.
See the difference? How your head's up
Yeah.
now? Your
Yes,
head's
sir.
not so far forward and over to the right anymore. That's just number one. We evened that out on both sides. Your hands are at your sides now.
Yeah.
Shoulders are squared off like you're back in the military again. Well, how would you compare that adjustment that I just delivered to you versus all the other chiropractic adjustments you've had in the past?
I've never felt anything like that before in my life.
Yeah, pretty cool, huh?
Yeah, absolutely.
So this is his first of 6 treatments. He's here twice a day for the next 3 days. And we're going to be doing this exact same adjustment on him twice a day, 3 days in a row. So we'll take a look at him on his last visit on Wednesday when he comes in. So David, what would you have to share with the world about your first experience here at Advanced Chiropractic Relief?
It took me a long time to get here, but I got here. If you have any issues going on and you think you need it, you do need it, and you need to come here.
Well, thanks. Thanks. I think most people figure that out on their own, but you kind of knew instinctively that you need to be decompressed.
Oh,
didn't you?
absolutely. Yeah, that is, after I watched the first video, it is a little
That's what I
thing in the
need.
back of my head. Yeah,
Yeah.
yeah. It's,
Let me see you just try to walk on your tiptoes again, see if that helped at all. It's already better.
Yeah, it is.
That's a little stronger than it was a minute ago.
Yeah.
Now, we don't expect to see all that come back immediately, but
But the
we're going to be
change-
testing him all the time to make sure of the changes that we're seeing in
Yeah.
neurology, just like your reflexes improved immediately.
It did. Yeah, that's
Pretty cool
that's
stuff,
that's
huh?
awesome. Yeah.
Your chiropractor should be doing pre and post orthopedic neurological evaluations on you to make sure that the treatment they're rendering on you is effective. Because when we test somebody, we look at their posture before and after, we see objective evidence that the treatment that I just provided, the adjustment that I just provided, has influenced his biomechanics in a positive way, which has also influenced his neurophysiological function.
Everything I've got up to today was, as far as post was, I'll see you next time.
See you Wednesday.
Right.
Friday. Yep. This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas, with David from San Diego, California. We'll see y'all soon.